Cataract, which affects many people around the world, especially in old ages. And most people think that surgery is the only solution. Now we are going to discuss about eye drops. Catalin eye drops manufactured by a Japanese company which could save you costly surgery. And note that this is for public awareness only. Always consult your hospital or clinic or doctor. So we are discussing about managing cataracts naturally. Public awareness initiative. We will understand the composition, mechanism and limitations of Catalin eye drops. Catalin eye drops, which could be a substitute for surgery, which could save you operations and also be cost effective. But then Catalin eye drops may not be applicable in all cases, and therefore it is essential to consult hospital or clinical doctor before acting on this video. The video does not encourage self-medication. You will have to consult your hospital or clinical doctor, but this is for public awareness only. Catalin eye drops, the alternative to cataract surgery. First of all, it is essential to understand what is a cataract. The front of eyeball must be transparent to allow light to pass. If the light does not pass into the eyeball, then you will not be able to see. You will see only if the light passes through the eyeball. So the front of the eyeball must be transparent. It must allow light to pass. Total or partial loss of transparency, that is any degree of opacity, transparency lost and it becomes partially opaque, will lead to blurred vision because light will not be able to pass freely. So if transparency is lost and opacity, that is opaque, that sets in, then it will lead to blurred vision, clouded vision. And this is mainly due to accumulation of denatured proteins or altered proteins or damaged proteins or sterols which cause such opacity. The opaque lens, why the lens becomes opaque? That is because of the accumulation of denatured proteins and sterols. This is what actually causes the lens to lose transparency, the lens to become partially opaque, which will not allow light to pass, and then you will have a blurred vision. So it is the accumulation of denatured proteins and also sterols, which mainly cause such opacity. Now here we are understanding cataract in greater detail. Cataract is a clouding of vision from reduced transparency of eye lens. Your eye lens is completely transparent. If it loses the transparency and becomes opaque, then you will have clouding of vision caused by denaturation or breakdown of crystalline eye lens protein. Your eye lens is crystalline, that is a crystalline lens, and the breakdown of the crystalline protein and accumulation of the breakdown products of the protein will cause clouding of the vision. Oxidants, that is ROS, reactive oxygen species, which will include hydrogen peroxides and superoxides. High glucose and sodium levels, in diabetic patients and hypertensive patients, triggering excess sorbitol production. Excess sorbitol. Heavy metal ions, mainly copper, inducing protein aggregation and deposition over eyeball. High sodium and high calcium, calpain enzymes stimulation, which will lead to lens damage, the denaturing of protein. Insufficient lanosterol and similar compounds that naturally protect eye. Lanosterol is anti-cataract. It is normally produced in the body. The body produces lanosterol, but if it fails to produce or if it is produced in insufficient quantity, then naturally you will not have the protection. Long-term use of glucocorticoid and psychotropic drugs. So lanosterol is produced by the body to prevent cataract. Naturally, normally it is produced, but if it is not produced or if it is insufficient, then you may get cataract. And high sodium and calcium, heavy metals like copper, high glucose sodium levels, ROS reactive oxygen species like hydrogen peroxides and superoxides, and denatured protein, that is breakdown of crystalline islands proteins causing the loss of transparency of islands leading to cataract. Now, introduction to Catalin. Catalin eye drops are usually safe, well tolerated, non-surgical treatment for cataract. Catalin eye drops usually safe, usually well tolerated, non-surgical treatment. Effective in early to moderate stages, best in early stage. Catalin works best in early stage with other lifestyle changes like diet. It is available as 0.005% eye drops, which you may do at home. You may instill or administer the eye drops at home. You don't have to be in hospital. And there's an eye drop. You can put it in your eye at home. You will administer the eye drops at home. Requires prolonged use to stop or slow down progression of cataract, but it is almost a lifelong or a long-term use of Catalin eye drops to prevent progress of cataract. Catalin, actually the chemical name is pyridoxine, 0.005% eye drops for cortical cataracts manufactured by Senju Pharmaceuticals based in Japan. In India, they are marketed by Allergan India Private Limited. Earlier in Japan, Takeda Pharmaceutical used to be the distributing marketing agents, and in India they are marketed by Allergan India Private Limited, manufactured by Senju Pharmaceuticals Company Limited, based in Osaka, Japan. So Catalin 0.005% pyridoxine eye drops, which actually is a home treatment, can prevent progress of cataract, particularly if it is detected in early stage. Now the active ingredient is pyridoxine. The primary active compound in Catalin eye drops, the key anti-cataract component in Catalin is pyridoxine, sometimes called PRX. Pyridoxine is sometimes abbreviated as PRX. So PRX is a main active compound, the chief anti-cataract component. It's a heterocyclic organic compound. You have got the chemical name and formula. Used in formulation as pyridoxine sodium and works at the molecular level at low concentration 0.005%, which means 5 parts in 1000. 0.005% low concentration means 5 parts in 1000 or 1 in 200 and works at the molecular level. So this is a pyridoxine PRX 0.005%. We have given you the formula, we have given you the chemical name. It's a heterocyclic organic compound. So pyridoxine or PRX is the primary active compound, the main anti-cataract, the cataract fighter, and is used in formulation as 0.005% because it works at the molecular level. Now the mechanism, how PRX retards lens opacity, how PRX slows down cataract progress. Catalin or PRX inhibits the binding of compounds to lens proteins and also prevents protein degradation, protein denaturation that damages lens transparency. It works as antioxidant, prevents accumulation of ROS, reactive oxygen species, protects against calcium-induced cataract formation and regulates the cationic calcium ion pump, which prevents or controls the calcium level and regulates the cationic pump function of the lens capsule so that high levels of calcium can be controlled. It will work as antioxidant, preventing ROS compound accumulation, prevent protein degradation, and also stop binding of compounds to lens proteins. So this is how PRX works to slow down cataract or prevent further damage to the eye lens. It stops cataract from becoming worse. It may not actually cure the part of the eye already damaged, but it can prevent further deterioration of the eye condition, further progress of cataract. Now, scientific basis, cataract formation theory. Cataract develops when denatured proteins accumulate on eyelids. Harmful binding of quinolones to these proteins cause lens opacity, hence loss of vision. PRX directly targets and prevents or retards this process. In addition, activates calcium ion pump and works as antioxidant. So it mainly prevents denaturing of proteins and binding of quinolones to these proteins and also works as antioxidants and activates calcium pump. So this is the basis on which the PRX eye drops or Catalin eye drops will prevent progress of cataract and prevent lens from being opaque. So clinical benefits of Catalin retards progression of cataract, preserves remaining clarity of vision. If 10% is damaged, at least 90% of the vision can be preserved by using eye drops without surgery. That's why we said Catalin eye drops, the best is if you use it in early stages of cataract. Early stages of cataract, when the damage to lens is minimum, you can preserve the remaining vision. Delays or obviates necessity of surgery in old and cancer or diabetic patients. Either you can think of eye drops lifelong and not go for surgery, particularly if the patient is very old, or if it is a terminal cancer patient, or a severe diabetic patient, or you can also delay surgery by a few years if you're using Catalin in early stages. And non-surgical option, eye drops administered at home. You don't go to hospital, no surgery, no operation. Cost effective because cataract operations are usually expensive. And using Catalin means it will not hamper routine daily life even for one day. So you don't have to go to hospital, you don't have to stay in hospital, no restrictions, just an ordinary eye drop, but it works best if cataract is detected in early stages. Now, limitations, temporary side effects. Now, these side effects are usually mild and resolve quickly, means no permanent side effects, and with continuous use, most of the side effects would disappear. It may be that you have these side effects on the first or second day, or maybe for the first 3 or 4 days, but afterwards all the side effects will go away. Burning sensation or itching upon application, that may be for a few days, but afterwards it will be okay. Temporary redness and tearing, that also for the first few days in some patients, and later it will be okay. Occasional superficial keratitis, eye irritation. All effects typically resolve quickly, so usually they are mild. So Catalin is well tolerated and safe in most patients, but still it is necessary to consult your doctor before using Catalin eye drops. Now, when to consider Catalin eye drops? Catalin is an option in cataract in very early stage. Surgery inadvisable due to age or other reasons. in patients where surgery is inadvisable or if the cataract is detected in very early stage. Surgery advised to be postponed, delayed. Surgery is necessary but needs to be delayed by a few years as a preventive for high risk patients like diabetic patients. Constant care and monitoring required. Long term use of Catalin, but constant monitoring is required. So, in summary, Catalin offers a non surgical cataract management option. Catalin works best in early stages and maybe sometimes in moderate stages, but best in early stages. Safe profile with minimal reversible side effects, requires consistent use, long-term use, prolonged use, and continuous monitoring. But yet, Catalin is a safe and non-surgical option in some cases, particularly in early stage of cataract. Now, as we emphasized, this is for public awareness only. The decision to choose between Catalin and surgery should be in consultation with your doctor or your hospital. Catalin is an excellent and effective treatment option in certain cases, but this choice should be done after speaking with your hospital, after speaking with your doctor. The video does not recommend self-medication, so take any decision after speaking with your doctor, after consulting your hospital, after consulting an expert.